In today's video, we are going to be looking at glycogen storage diseases, everything you need to know to not fail another question on the USMLE. Hello guys, welcome back to the channel. My name is Uche Kennedy, and on here we talk about everything USMLE, step 1, step 2 CK especially. This is the beginning of a new series, USMLE Step 1 in Focus. And what we are going to be looking at on Step 1 in Focus is basically covering those subject areas that you find very difficult to understand or challenging to remember. I'm going to take them, I'm going to break them down to you, or for you, the way I would do for my students, in a way that is easy to remember long term. You will understand them perfectly, you will remember them, and you will be able to apply them when you do questions. So without wasting any more time, let's jump right in. All right. Glycogen storage diseases. For us to talk about glycogen storage diseases, we have to first consider the structure of glycogen. You remember that glycogen comprises of a chain of linked glucose molecules and, of course, branches as well. These branches allow us to have a compact structure for glycogen. So instead of just having an endless chain of glucose molecules, we can branch out and have some from the branches. For example, we could have another branch over here and so on and so forth. There are different types of bonds at different points and different enzymes that break down these bonds. You will remember that glycogen is a storage form for glucose. And during fasting, meaning when we've not eaten for a while, the body needs to break down glycogen to release glucose. That is the whole point. We need to break down glycogen to release glucose. Now, what are the enzymes that break down glycogen? First of all, we have glucose connected to glucose over here, connected to another glucose over here. This bond between the glucose molecules is broken down by the first enzyme we are going to be looking at, alpha 1,4-glucosidase. This enzyme is alpha 1,4-glucosidase, and it's also called acid maltase. That's the first thing I want you to remember. We break down the glucose to glucose bonds with alpha 1,4-glucosidase, the enzyme, a hydrolytic enzyme, also known as acid maltase. The second kind of bond we are going to consider is the bond around the branches here. So when this branch is formed, it's a different type of bond. This bond is broken by alpha 1,6-glucosidase. So alpha 1,4-glucosidase to break down the alpha 1,4 or the glycosidic bond, alpha 1,4-glycosidic bonds, alpha 1,6-glucosidase to break down the alpha 1,6-glycosidic bonds, if you want to think of them like that. But these two enzymes are very important. At the end of the day, you're going to break down these bonds, release glucose molecules. So that is our glucose molecule over there. I think I like my glucose in red. So let's make glucose red. This is glucose. You want to note that this glucose molecule is phosphorylated. Okay, so each of these individual glucose molecules actually has a phosphate group on them. But what we want is glucose, not glucose phosphate. So we need another enzyme to remove that phosphate group. And what do you think that enzyme is going to be called? That's a phosphatase enzyme, glucose 6-phosphatase. So we've seen three important enzymes: alpha 1,6-glucosidase, alpha 1,4-glucosidase, and glucose 6-phosphatase. These are the three I need you to remember right now. So what do we mean when we talk about glycogen storage diseases? Glycogen storage diseases are simply diseases that occur when any of the enzymes that play a role in the breakdown process of glycogen is simply not working or is absent. Okay, so alpha 1,4-glucosidase could be absent, glucose 6-phosphatase could be absent, or alpha 1,6-glucosidase could be absent. Remember where each of these bonds are found because it's going to become important. We'll start looking at some of these diseases. The first disease we are going to consider is pompase disease. I know you've learned about the pump, but this is how I want you to remember pompase disease. Pompase disease is exercise intolerance and heart. Exercise intolerance and heart, meaning when I give you a vignette and you read this vignette, you know it's on glycogen storage diseases. You are looking for one thing to know it is pompase disease: the heart. They are going to tell you the patient has muscle weakness, the patient has all these other symptoms. The only thing we care about is heart. exercise intolerance, and heart is Pompey's disease. Everybody with a glycogen storage disease will have exercise intolerance. They may not say exercise intolerance on your exam. They may say hypoglycemia. So exercise intolerance or hypoglycemia plus heart is Pompey's disease. Exercise intolerance plus muscle is Mercado's disease. Again, exercise intolerance plus heart is Pompey's disease. Exercise intolerance plus muscle is Mercado's disease. You want to take note of that. The enzyme that is deficient in Pompey's disease is alpha-1,4 glucosidase, also known as acid maltase. You want to remember that alpha-1,4 glucosidase is both a glycogen storage disorder, of course, an enzyme in the glycogen storage pathway, but this enzyme is also a lysosomal enzyme. So if I asked you which of the enzymes that are deficient, which of the enzymes deficient in glycogen storage diseases or disorders is also a lysosomal storage, is also a lysosomal enzyme, then the correct answer is going to be Pompey's disease. People with Pompey's disease will have cardiomyopathy and heart failure. That's all you're looking for. Signs of heart failure in a patient with glycogen storage disease equals Pompey's disease. Next, we look at Mercado's disease. Mercado's disease is exercise intolerance and muscle. Everything is muscle, 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 muscle. Nothing else. Muscle pain, muscle spasms, muscle cramps, muscle weaknesses. Now, will patients with Pompey's disease have some muscle weakness? Of course, there is hypotonia right there if you look at it, for example, right? But we don't care about that. Do they have cardiomyopathy? Do they have heart failure? Yes. If yes, that is Pompey's disease. In Mercado's disease, we don't have any heart failure. We just have muscle. Exercise intolerance plus muscle is Mercado's disease. They will have muscle weakness. They will have muscle cramps. They will have myoglobinuria because you're breaking down the muscles, and all these muscle breakdown products, myoglobin, are ending up in the kidney, for example. This myoglobinuria, you can imagine, might even result in renal failure. So with a patient, for a patient with Mercado's disease, you may even be looking at someone that has renal failure as well. Now, what happens in Mercado's disease? In Mercado's disease, we have specifically skeletal muscle glycogen phosphorylase, or what we call myophosphorylase, muscle phosphorylase. This is an enzyme that helps break down glycogen, but it is only found in the muscle. It's specifically found in the muscle. Why do people with Mercado's disease not have a lot of other symptoms? Why is it just muscle? Because majority of your glycogen stores are in the liver, and the liver is able to produce enough glucose from the glycogen stores to keep the rest of the body running. However, the muscles are going to suffer because they cannot use the glycogen stored in them. The other thing you would need to remember about people with Mercado's disease is that because your liver is producing glucose anyway, they don't develop lactic acidosis. So people with Mercado's disease do not develop lactic acidosis. Sometimes this is described as a flat, as they are described as having a flat venous lactate line. I've had a student ask me, what does that even mean? It's in your first aid, I think. A flat venous lactate line, what it basically means is that the lactate levels don't change. So when you look at their lactate levels, it does not go up and down to indicate hypoglycemia or no hypoglycemia. Their lactic acid levels are constant. Okay? You want to remember that for Mercado's disease. Again, exercise intolerance plus heart, Pompey's disease. I need to say it out loud. Exercise intolerance plus muscle, Mercado's disease. Next, we have exercise intolerance plus liver, mild and severe. Exercise intolerance plus liver. You can think of this as hepatomegaly. Exercise intolerance plus hepatomegaly. Now, it could be mild hepatomegaly or severe hepatomegaly, and we have two diseases we are going to be looking at: Cory's disease and von Gert's disease. Exercise intolerance plus mild hepatomegaly, Cory's disease. In Cory's disease, you have an alpha-1,6 glucosidase deficiency. Alpha-1,6 glucosidase deficiency. Do you remember where we had alpha-1,6 glucosidase? Do you remember where we had that enzyme? You remember that it was where the glycogen was branching out. You remember that over there? Alpha-1,6 glucosidase. When you don't have alpha-1 6 glucosides, what happens? You break down glycogen. You break it here. You remove all these glucose molecules, but you don't remove the branch. You have that remaining glucose molecule, or those glucose molecules around the branch that you don't quite break down. That remnant is called limit dextrin. That remnant is the limit dextrin. So in Cory's disease, where you have a deficiency in alpha-1 6 glucosides, you have mild hepatomegaly and you have an accumulation of limit dextrin. So if I ask you what is the presentation for Cory's disease, I need you to tell me mild hepatomegaly, Cory's disease, exercise intolerance plus mild hepatomegaly and limit dextrin accumulation, for example. Next, we have von Gerk disease, perhaps the most severe of them all. Von Gerk disease is exercise intolerance plus liver, severe in this case. Exercise intolerance plus liver, severe or severe hepatomegaly. Why is von Gerk's disease so severe? You would remember once again that I told you when you release these glucose molecules, each of these glucose molecules is charged. It has a phosphate group. Think of that phosphate group as making that glucose molecule a charged molecule. What does that mean? When you have a deficiency in alpha-1 4 glucosides or alpha-1 6 glucosides, you're not able to break down glycogen, but you don't have charged glucose molecules loitering around in the blood or in the tissues or in the cells. When you have glucose 6 phosphatase deficiency in von Gerk's disease, it is not just an inability to break down glycogen. It is the accumulation of charged glucose molecules. You're supposed to remove this phosphate group so that we are left with just glucose by itself. But now you can't do that. And so we have these charged glucose molecules. And these charged glucose molecules are much more toxic to your tissues than every other form we have considered. This charged molecule will pull more water in. It will cause more energy loss to the cells. And therefore, the presentation of a patient with von Gerk's disease is much worse or more severe compared to all the others. Exercise intolerance plus liver, severe hepatomegaly. The enzyme that is deficient is what? Glucose 6 phosphatase. The phosphatase, a phosphatase enzyme is an enzyme that removes phosphate group from something. You would remember that a kinase enzyme is an enzyme that adds phosphate group, right, from your biochemistry. A phosphatase removes phosphate group. So we have that glucose 6 phosphate molecule, that glucose phosphate molecule accumulating, a highly charged molecule, and these patients will have severe hepatomegaly. In addition, they will break down a lot of their liver cells and other cells in the body, develop hyperuricemia from all those DNA that have been broken down. They develop lactic acidosis, and these patients may also have hypertriglyceridemia. Now, of course, this list is not exhaustive at all. A patient with von Gerk's disease, you have to treat those patients. You have to give them a lot of glucose orally, because no matter how much they store glycogen, they cannot use glycogen at all. I hope that makes sense. So now, if I asked you a few questions real quickly, exercise intolerance plus heart, what would that be? Exercise intolerance plus heart. I hope you said Pompey's disease. Do you remember the enzyme that was deficient in Pompey's disease? I hope you said alpha-1 4 glucosides. What's it also called? Acid maltase. Very good. What other important detail can you remember about Pompey's disease? This is the only one. The enzyme alpha-1 4 glucosides is also a lysosomal enzyme. So Pompey's disease is like a glycogen storage disease, but the enzyme alpha-1 4 glucosides is also a lysosomal enzyme. So if I also said exercise intolerance plus muscle, what would that be? I hope you said Mercado's. Well, M for muscle, M for Mercado's disease. You would remember that Mercado's disease is a deficiency in myophosphorylase. This is where we said everything is muscle. There was no lactic acidosis, so they are described as having a flat venous lactate line. If I said exercise intolerance plus hepatomegaly or liver, to be consistent here, exercise intolerance plus liver, but the mild version, mild hepatomegaly. I hope you said Cory's disease. And if I said exercise intolerance plus liver, severe with lactic acidosis, hyperuricemia, hypertriglyceridemia. I hope you said von Gex disease. Now, of course, there are other glycogen storage diseases like Anderson's disease in your book. There is Haas disease. These are not super important for the USMLE, and so I'm not going to bore you with them. These four you absolutely need to know, and I think it is easier for you to learn them in this fashion. In this Step 1 Focus series, we are going to be covering all these difficult subjects or subject areas, things that are difficult to remember. If you have any particular area you want me to cover, let me know in the comment. If you're new to the channel, please subscribe to the channel. I appreciate it a lot. Help us grow, and share the videos to people that will benefit from it. And if you need to contact me, there'll be a lot of ways to do that in the description as well. Until next time, I'll see you guys soon. Bye-bye.